Back with some breaking news coming in. 3,016 new cases of COVID-19 being recorded in the last 24 hours. The daily positivity rate has also now increased to 2.73%, with the number of cases breaching 5-month high. Let's go across to my colleague Mayank, who's joining us on the broadcast with the details. Mayank, this is quite concerning. There's been a 40% jump in the number of cases that have been reported owing to COVID-19, and we've seen states that have also called for high-level meetings to discuss and to ensure that the cases are under control.
Well, yes, the number of cases have gone beyond 3,000 mark, and which is quite concerning on one point, because even the test positivity rate has already doubled since the last week. So a number of cases was more than 2,100 yesterday, and in the last 24 hours it is 3,016. So it will raise some sort of concerns, and in fact even in the national capital as well. So more than 300 cases were reported yesterday, and now it has prompted a response from the government, with the Delhi government calling for emergency meeting today, where they will be discussing the strategy going ahead as far as the stepping up the medical infrastructure is concerned. So on all accounts, we have already seen that Union Health Ministry writing to states which are reporting the highest number of cases, and that there will be a mock drill as well on 10th and 11th of April, and all the states have been asked to ramp up their medical infrastructure. Okay, all right. May I request you to stay on with us? Dr. Sanjeev Bagay is also on the broadcast with us. Dr. Sanjeev Bagay, just last week we were having this discussion on how concerning the number of cases of COVID are, but now we're seeing it has breached, the 5-month high as well. 40% increase in the number of cases. What can be done about it? What are the precautions that people should be taking?
Hi, good morning. So to break this down genetically in terms of genomic structure, the sublineages which we are seeing of the Omicron original variant, which are more than 1,100 at the present moment, is what we call as XBB 1.16 and XBB 1.5. These are more immune invasive, giving higher risk of breakthrough infection and reinfection. Therefore, the advice goes as follows. Please wear a mask, avoid crowded places, poorly ventilated places, and get your third vaccine, which is your booster dose. Apart from that, the message really is not to panic. Large majority of these strains are milder, but mild is a relative term. Therefore, in the vulnerables and the people with comorbidities, it can still give a serious infection. A natural immunity to get infection is not the way forward. Therefore, vaccines are important. The message is not to panic. The numbers will rise when there is a small surge like this. There is no way that this is going to turn out to be a wave as such, or a restriction as such. But I think simple precautions are a must at the present time.
Okay, all right. Dr. Sanjeev Bagay, thank you for joining us. Thanking Mayank as well for joining us with those inputs. But of course, the government has also conducted mock drills to ensure that people know that our health infrastructure is well prepared for any such eventuality. But we need to mask up and ensure that we take our precautions. On that note, we're slipping into a short break here. Don't go anywhere. We'll be right back.